Recently, the Missouri Department of Health and Senior Services urged parents to check their child's vaccination records. You're looking for something called an MMR vaccine that protects against measles, mumps, and rubella.
And with cases on the rise, KSHB 41 reporter Abby Dodge listened to what doctors are seeing in their offices.
Doctors in the metro do not have waiting rooms full of patients with measles. The most recent case was tracked through KCI by a Liberty resident in mid-January. But the state of Missouri is taking note of a rise in cases nationally. Cities like Chicago and Miami have reported multiple cases in children. Dr. Todd Fristo is a St. Luke's family medicine physician.
I don't think we want to scare people and make them alarmed. Oh, we're all going to get, measles and have all kinds of trouble, but have people be aware of it.
Doctors recommend kids get their first MMR dose at 12 to 15 months. That has a protection rate of 93%. The second dose bumps up that rate to 97%. Children typically receive their second dose from 4 to 6 years old. Dr. Fristo says that he's gotten more questions about vaccines in the last few years.
It's very important as healthcare professionals to validate their concerns. That doesn't mean you agree with all of their concerns, but you validate them and you understand that they truly are concerned for the well-being of their family or their children or their loved ones.
Measles is a highly contagious virus. If I have measles and show up to a meeting with 10 other colleagues who haven't been vaccinated or haven't had measles before, up to 9 of them could contract the virus. Say you forgot your phone at that meeting and come and grab it an hour or two later. The measles virus is still hanging in the air.
So it's very easily contracted if you're exposed to someone with measles.
A 95% vaccination rate is recommended for herd immunity. DHSS in Missouri says public schools are reporting a 90.5% MMR vaccine rate for kindergartners this school year. That's down from 95.4 in 2016. Some pediatric offices require all patients to be vaccinated. Dr. Fristo says sometimes it takes few visits before patients are comfortable with a vaccine.
It's just all about being respectful to that other person and listen to their concerns and then try to guide them to accurate sources of information.
In Kansas City, Abby Dodge, KSHB 41 News.
As cases of measles increase, it's important to be aware of the symptoms. The Mayo Clinic says symptoms include fever, dry cough, runny nose, sore throat, and rash. So that rash will look like large flat blotches that often flow into one another. The infection happens in stages too, over 2 to 3 weeks. You won't see any symptoms over the first 10 to 14 days after infection. Then you'll see those symptoms like fever, cough, and runny nose. After that, the rash will appear. The face breaks out first, and the rash may last about 7 days or so. You should call your child's doctor if you think your child may have been exposed.